Welcome to the Center for Cosmetic Surgery and MediSpa in Baltimore, Maryland. Joy is a patient of Dr. Kane. She just had a tummy tuck. She has a fabulous result. And right now, she's in the back having a consult with Lauri Kane about CoolSculpting, the newest technology to freeze your fat. Let's take a listen.
Hi Joy, how are you?
I'm doing great.
How have you been since your tummy tuck?
Wonderful, wonderful.
Yeah, you're happy with the results?
I am ecstatic about the results, and now I want to talk about CoolSculpt. I heard that Dr. Kane is now performing CoolSculpt, and I have some, since my lovely tummy tuck, I've had some other areas that I'm noticing, and I want to know if I am a candidate for CoolSculpt opposed to liposuction. I don't have a lot of time to be off work since I was out for my tummy tuck. Now, I want to know about CoolSculpt.
Okay, great. Well, let me fill you in on how CoolSculpting works,
Okay.
and then we'll talk about what parts of, what areas of the body you're interested in.
Okay.
Okay, so here's our machine, here's the CoolSculpting,
Okay.
and here's the actual arm and the cup that you used to place on the body.
Okay.
So this is kind of where the fat has to fit in.
All right.
And basically, this arm holds two panels of cooling panels. And what happens is the bulge of fat has to be sucked into, right in here, right into this panel. And then there's a suction. So here, like, I think, did you
I'm
know?
interested in my arms because...
Yeah, and it does work on arms.
Okay.
So basically what we would need to do is make sure that this area would fit on the arm,
Okay.
and then the skin is sucked up into these panels.
Okay.
These panels, these cooling panels, freeze the fat.
Oh.
Fat is very sensitive to cold.
Okay.
So while the outer skin does okay, the actual panels go in deeper and actually freeze the actual fat. It's left on for about an hour, and then this is removed, and then you're left with somewhat of a thick area that's very cold.
Okay.
That area is massaged down, and then it could be a little achy for about 4 or 5 days, and then it takes about 30 days for the fat to just kind of dissolve and be absorbed into the body.
Is there any downtime?
That's what's so amazing. There's absolutely no downtime. So like someone like yourself who had a tummy tuck, and I know you've been off from work for about 3 to 4 weeks, you could go right back to work. You could do it on a lunchtime.
Right.
We have evening hours. We have weekend hours.
Weekends, wow.
Yeah, we have, so it's perfect.
Okay.
And it really allows you to go just right back to work. There's no garments.
No scars?
There's no scars. There's no surgery. There's no anesthesia. There's no limitations. You basically can return back to any work you do or normal activity, exercising. So it's really an ideal way to go.
Okay, do I need any pre-op testing like when I had my tummy tuck?
Nope, no pre-op workup. You basically, we have like this kind of a consultation.
Okay.
We set up an appointment for you to come back when you'd like to have it done.
Okay.
And you'll sit for about an hour. Then what happens is, a lot of people ask, well, how many areas can I do at one time?
Yes.
So basically, obviously with your arms, we would do both arms in a session.
Okay.
It's 1 hour per session.
Okay.
You'll sit, relax, and bring a book, bring your iPad, whatever you're comfortable. And between each hour, you can get up and move and go to the bathroom, get something to drink or eat, and then we come back and we do the second hour.
Okay, great.
And there's some people who like to do multiple areas.
Exactly.
Were there other areas that you were interested
I
in?
am interested in some back fat and maybe my upper abdomen.
Yeah. That back fat women hate.
Yes.
We
yes.
hate that back fat.
Exactly.
And the other area always people hated the breast rolls.
Exactly, exactly.
So that would be another great area, and we can either do your arms one day, and we can also add into the back rolls on the same day.
What about inner thighs?
You can do inner thighs. This is the key about inner thighs.
Okay.
If you can grab it,
Yes.
and we can get it sucked into the arm,
Okay.
then we can do the inner thighs.
Okay, wonderful.
Yep.
So a lot of areas.
A lot of areas.
Okay, wonderful.
Would you like to set up that consultation?
I would.
The consultation
I
have it
would.
done?
I would.
Perfect. All right. We
Okay.
will go out and we'll do that for you today.
Okay, thank you.
All right. Thank you.